So I just wanted to welcome everyone who's listening to this presentation, and also thank um, Dr. Cosman for being here. I think to start off the presentation, or the interview, we can sort of just have you introduce yourself, your current position, and sort of your educational and career journey.
Sure. Hi, I'm Bart Cosman. I'm a professor of clinical surgery at University of California, San Diego. I'm in my 28th year of practice and a faculty position, so kind of on the senior side. I'm a general and colon and rectal surgeon. I can explain what that means later. And then I spend my days taking care of patients and teaching residents and medical students. The residents are in a general surgery program, which we graduate 7 qualified surgeons per year out from University of California, San Diego, and they become either community or academic surgeons. And then our medical students are going into all fields, and we try and teach them the basics of surgery. My job is as a clinical teacher. I do a little bit of research, but primarily clinical work and clinical teaching.
Mm-hmm. Okay, and if you could sort of like explain your sort of educational journey to where you've gotten your undergrad degree, your medical degree.
Yeah, so I'm from back east. I'm from New Jersey originally. I went to Harvard College in Cambridge, Massachusetts. I went to the medical school at Columbia in New York City, formerly known as the College of Physicians and Surgeons. Now it has a different name, but it's Columbia University. And I guess for folks' interest, I was not a biology or a biochem major. I was a history of science major, for what that's worth. And back in college, and then in medical school, I did a combined MD MPH degree. So graduated after 4 years with both those degrees. My original plan in medical school was I was always interested in aviation and space and wanted to go into aerospace medicine, and then just found that surgery was more fun and more interesting than anything else. And I have not regretted that decision much as I feel like, if one had a coherent vision from the beginning of one's career, one might have done things more efficiently. I've enjoyed being in surgery. I did my surgical residency at Stanford University. Became a Californian, married a Californian, and haven't left too much ever since. And then after surgical residency,
Oh, the internet is acting up again. I'm not able to. It says that my internet connection is.
Been here ever since. I can hear you okay.
You can hear me? Okay. Okay. I mean, while you were talking, there were a lot of things that sort of came up. I didn't completely catch what you said at the end because you were sort of cutting off. But I got to the Stanford part, and what I was sort of wondering, like a lot of questions popped up in my head, but what I was sort of wondering is how you developed an interest for medicine, because you mentioned that you had interest in like physics. You were talking about like, I'm not sure, aerophysics medicine. I'm not sure what you said, but then you were also saying that you were interested in history, which is what your undergrad degree was on. So how did you go about, like, how did you develop an interest in medicine? And how did you sort of decide to go into surgery in particular? Very difficult to be conducting an interview at school because the Wi-Fi isn't reliable all the time. Just give me 1 second. Okay. I'm not sure how much of the interview is being picked up at the moment, but it does say that the recording is in progress, so hopefully.
I'm
Um,
actually having trouble with your sound, in the sense that I can hear you talking, but I'm not getting the words.
is it okay if I just speak louder, or I
That
might?
works. That works great. Yeah.
Okay, yeah. I'm just having trouble with the internet because like the Wi-Fi at my school is very unreliable, so I've changed my setting a little bit, and hopefully, our recording so far picked up what we were saying. But you were kind of talking about, in case it didn't pick up, I guess to summarize what you said, you were talking about how you were from originally from the East Coast, and then you went to college in Harvard, and then you got your medical degree in Stanford, I think, and you just talked about how you
Columbia.
settled Columbia. I'm sorry, Columbia and residency in Stanford. Is that right? Okay.
Yeah, but
Um,
then fellowship at University of Minnesota.
okay. Yeah. So my question to you before it sort of cut off was, how did you um, going through, you talked about how you were interested in different things before you landed in medicine. So maybe you could repeat that again in case the video didn't pick up, and just sort of explain how you became interested in medicine at all, and why surgery.
Yeah, I think one thing I always tell folks who are interested in medicine is that you don't have to leave any of your other interests behind. That medicine is a humanistic discipline. I really believe that, and I think I can demonstrate that with my career, and so it's not just talk. Uh, having having said that, I have in fact changed interests a bit. I started out interested in aerospace matters. I was interested in, I was a history of science major, and I wrote a thesis on the history of aerospace medicine. That was my original plan going in. So it wasn't so much that I was not interested in medicine, but I was interested in medicine of a different type. That was actually the reason why I went to public health school as well, because aerospace medicine is part of the is boarded as part of preventive medicine, and you need an MPH to move forward in it. In any case, the change to surgery for me was a matter of, that was, I was trying to learn more about, my own interests and what I would like to do for the rest of my life, and surgery was very attractive in that you get the immediate gratification of having built something or fixed something, and you've done it today. You see the results today, which is not that true in the rest of medicine. Certainly not that true in science, and so I don't have the patience and perspicacity to work in a lab, for instance. I've tried that and failed, and I really do like the immediate gratification of surgery. That fits my character, and so finding something that fits your character is always good. And if you find that you're in a field that doesn't fit your character, it's better to switch than to tolerate it for the next 30 years.
So, one question. So, if you're saying that you believe strongly in how it is important to still pursue things you're passionate about, despite going into medicine, but how do you think you might do that? Because surgery does, the amount of education that you need to get to become a surgeon is a lot, and it is time consuming. We have changes in your schedules all the time. So, how do you find time to still pursue the things that are important to you? So hello everyone listening today. My name is Riddhi Nanda Kumar, and I'm here today with Dr. Bart Cosman, who will be talking about his experiences with us today. And I think that it would be a good idea to start with him sort of giving us an introduction of his positions as well as sort of educational and career experience.
Thanks for the opportunity. I'm Bart Cosman. I'm a professor of clinical surgery at University of California, San Diego. I'm based at the VA hospital. I'm a clinical professor, which means that I spend most of my time doing clinical work and teaching both residents and medical students. residents in a general surgery program and medical students in general in their third and fourth years of medical school. My educational background, I was a Bachelor of Arts, actually, History of Science major from Harvard, and then went to Columbia for medical school. Did an MD MPH program there, majoring in environmental science on the public health side, and then went to general surgery residency at Stanford. Was there for 7 years, including 2 in the lab, and then did a 1-year colon and rectal surgery fellowship at the University of Minnesota, at which point I got my first job on the faculty at University of California, San Diego, and have been here for the last 27 years.
Okay, so my first question to you is sort of about how you became interested in the field of medicine, because you've mentioned a lot of your different interests along the way. And just how did you figure out that medicine was what you wanted to do, and how did you realize that you were specifically interested in surgery?
First of all, about medicine, I had medicine in the family. You know, my maternal grandfather was an internist, and my father, who unrelated, was a academic plastic and reconstructive surgeon, and so I knew about medicine and surgery as career options, and I thought very highly of them. It seemed like medicine was a way in which you could be in a people-facing profession and still be the kind of person I was, which is not totally socially adept and a little bit obsessive compulsive, you know, just character-wise, and also like those are good things in this field as opposed to being bad things, and also it seemed like a field in which one didn't really have to leave any of one's interests behind. One could integrate them with and become a better doctor with almost any interest or thing that you're good at outside of medicine, using that and using the skills that you've acquired there. I also then thinking I wanted to go into a different field of medicine to start with, I ended up seeing that surgeons had more fun and more immediate gratification than other doctors in the hospital anyway. And so I decided to switch to surgery in my third year of medical school from an original career plan, which was different. And I haven't regretted that decision. I still enjoy the direct gratification of finishing an operation and knowing I've done something good that has made a difference that day, as opposed to potentially made a difference years in the future, which is what it was more like when I was working in the lab.
Okay. I'm sorry, this is kind of okay. So my next question for you is sort of about how you particularly gravitated towards colorectal surgery, and how what you would advise the students who are sort of like thinking about surgery, and how did you decide that you wanted to specialize here? Is what I was saying.
Yeah. So first, how to gravitate to surgery. I think surgery kind of calls you or it doesn't, and I meet people. When I'm interviewing, for instance, for our residency program, I meet people who wanted to be surgeons since they were 6, and I admire that because they knew. But I also have a healthy respect for people who have a career path like mine, in which they wanted to do something else, and then they just fall in love with something. When you fall in love with something late, you tend to stay in love with it. And so, unless you're a sort of serial, person who falls in love with a lot of things in sequence, in which case you're not committed. But I think the people who figure it out relatively late, that this is their tribe, and they really fit in character-wise. The boys and girls who do that tend to stick with it and be good too. And so I don't have a particular prejudice. And I think if one figures out that that's what one wants to do, it doesn't matter when. As far as colon and rectal surgery, you, especially if you're interested in academics, you want a niche. You want something that you do that other people don't do, or that you do better. And the various subspecialty certifications within surgery or within other fields like internal medicine do
Mhm.
provide that niche. I like, and there again, you can say, try it out, do a rotation in that area, see if that feels good to you. The general recommendation for subspecialties is you got to like the least glamorous part of that subspecialty. Like for instance, in colorectal surgery, sure everyone wants to and do and likes the big operations, general surgeons and colorectal surgeons alike. But if you like the anal operations, the ones on hemorrhoids and fissures and fistulas and warts and things like that, if you like that, then colorectal surgery is a good field for you. Another example, say in endocrinology, if you have to like diabetes to be an endocrinologist because that's the daily work and the really cool stuff, the adrenal workups and such, don't happen that often. So figure out a field in which you actually enjoy the day-to-day work, the least glamorous part of it, then that'll be a good field for you.
My next question to you was sort of about